the BBDUMC YouTube channel. I am Susmita Gokhale, the Vice President of the BBDUMC Quizzing Society, and today we are going to be looking at an overview of the topic vasculitis. Firstly, what is vasculitis? It is the generalized inflammation of the blood vessels due to any specific etiology, giving rise to specific clinical characteristics. Now let us look at its classification. We can classify it as immune mediated or infectious according to the this is this is the Chapel Hill classification of vasculitis. So vasculitis, according to the vessel that affects, can be classified as so if it affects the large vessels, it can be classified as giant cell or Takayasu arteritis. So there is a trick to remember this. So large in terms of height is called as tall. So T for temple and T for Takayasu. Next, there is vasculitis which affects the medium vessels. So there is polyarteritis nodosa and Kawasaki disease. Then there is the arteritis that affects the small vessels. So it can be ANCA mediated or non-ANCA mediated. What are ANCAs? ANCAs are anti-neutrophil cytoplasmic antibodies. So they can be of two types. There are PANCAs and CANCAs. So the ANCA mediated arteritis includes vaginal granulomatous syndrome and microscopic polyangiitis. And the non-ANCA mediated includes Behçet's disease and Henoch-Schönlein purpura. So firstly, we'll see the vasculitis that affects the large vessels. So firstly, there is the temporal vasculitis. So why is it called temporal vasculitis? It is called temporal vasculitis not because it affects mainly the temporal blood vessels. It is called so because the vessels that are easily biopsied are the temporal vessels. Hence, temporal vasculitis. It is also called as giant cell vasculitis. So when we see the histological picture, we see giant cells present in the inflammation. So that is this arrow here shows the giant cell. Hence, it is also called as giant cell vasculitis. This is a picture that is showing the forehead. So it is showing the superficial temporal vessels. So this kind of vasculitis is characterized by lesions which are nodular and tender on the blood vessel. Moving on to Takayasu arteritis. So as the name suggests, it is more predominant in the Japanese population. So here we can see the arch of the aorta. So it is thickened. It is also called as aortic arch syndrome or or aortitis because it commonly affects the aorta. So what we have to know between Takayasu arteritis and temporal arteritis is that temporal arteritis affects the age groups more than 50 years, while Takayasu arteritis affects age groups that are lesser than 50 years. Japanese people are hardworking and very active. So we can remember that young people and Japanese. So Takayasu arteritis affecting young people, while temporal arteritis affecting the elderly, because elderly get headaches more commonly. Then the histological picture of Takayasu arteritis is similar to the temporal arteritis. Here the two arrows are showing giant cells in the in the artery wall. So coming back to the classification, we right now studied the vasculitis that affects the large vessels, which includes the temporal arteritis and Takayasu arteritis. Now we'll look at the arteritis that affects the medium vessels. So firstly, we have the Kawasaki disease. So again, as the name suggests, it was first discovered in the Japanese population. Now it can be also found in the American population. So this is a very common mnemonic for medical presentation of Kawasaki disease. So it is crash and burn. So crash and burn, C stands for conjunctivitis, R stands for rash, A stands for adenopathy, S stands for strawberry tongue, and H stands for hand and feet erythema. And burn stands for fever for more than 5 days. So this is how you can clinically diagnose that it is Kawasaki's disease. It commonly affects the medium-sized vessel. Moving on, we have Panarteritis nodosum. So this kind of arteritis commonly affects the medium blood vessels, as I previously said. Now, when we look at this histological picture, we see some fibrinoid necrosis here, which is light pink in color. And this is the wall of the artery, and the lumen of the artery seems to be occluded. So there is a mnemonic for this, which is PAN, like PAN is a Hep B fan. So PAN stands for polyarteritis nodosa. So you can also look at it this way, that stands for pulmonary artery. So PAN never affects the pulmonary arteries. So PA, pulmonary arteries, N stands for no. So no affection of the pulmonary arteries is a Hep B fan. So Hep B stands for hepatitis B, as it is commonly seen in those affected with chronic hepatitis B. FAN stands for F stands for fibrinoid necrosis. A stands for abdominal symptoms such as pain and bloody stools. N stands for peripheral neuritis, which affects mainly the motor nerves. So now we studied the arthritis that affects the medium-sized vessels. Moving on, we have the arthritis that affects the small vessels. Firstly, we'll see the ANCA-mediated arthritis. Firstly, we have microscopic polyangiitis. It is also known as leukocytoclastic polyangiitis. These lesions resemble PAN and show fibrinoid necrosis, which is light pink in color, as you can see. In this, all lesions are of the same age, unlike in PAN. The pulmononephritis are the most commonest lesions. So you can remember the saying PGMP. So PG stands for pulmonary capillaritis and G stands for glomerulonephritis. MP stands for microscopic polyangiitis. Most of the cases of microscopic polyangiitis are usually associated with MPO-ANCAs. Next we have is Metzner's granulomatosis. So as this name suggests, it is associated so granulomas are consisting of giant cells, and they also have multiple lymphocytes. Wegener's granulomatosis is characterized by a triad, which is seen by the presence of granulomas in the upper respiratory tract and the lower respiratory tract, or both. And there is vasculitis, which involves mainly the lungs and the upper airways. And there is crescentic glomerulonephritis. It commonly affects males more than females. So here these two arrows show granulomas. And this section of the lung showing necrosis with a cavitatory lesion. Next, we have the Church-Strauss syndrome. So this is also known as allergic granulomatosis and angiitis. So it is a immune-mediated reaction caused by hypersensitivity to an allergic stimulus. So like in any allergies, what we see here is rhinosinusitis, asthma. There is a rise in the body temperature and fatigue also. There may be the common characteristics of type 1 mediated hypersensitivity reactions seen in allergies are an increased level of eosinophils because there is infiltration of the tissues by eosinophils. It is now also known as eosinophilic granulomatosis with polyangiitis. And there are abnormal lung lesions, as the most commonly affected organ is the lungs. This is a visual picture that will help you remember that it mainly affects, and it is also eosinophil mediated, as it is an allergic kind of vasculitis. So vasculitis can also occur in conditions like SLE. So it is not necessary that there has to be a specific, it has to affect the specific vessels. Now let us recap what we have seen. So inflammation in vasculitis can be granulomatous or necrotizing. So here what you have to note is that in Wegener's granulomatosis and in Church-Strauss syndrome, the inflammation granulomatous inflammation or necrotizing inflammation. When I say necrotizing inflammation, I mean fibrinoid necrosis, which is most commonly seen in blood vessels. So granulomatous inflammation is seen in the large vessels that are affected by vasculitis. like in Takayasu arteritis and giant cell vasculitis. And necrotizing inflammation is seen in microscopic polyangiitis and polyarteritis nodosa. So I hope this video helps. And for more content like this, and subscribe to BBDUMC Quizzing Society YouTube channel. If you have any query or doubt, you can post them in the comments below, or you can message us on the email, which is bbdumcquizingsociety@gmail.com. Thank you.